What is anthrax? Anthrax is an infectious disease process caused by a bacterium. On this slide, you can see a picture of anthrax growing on a plate of agar. Who is at risk for anthrax? Anyone who comes into contact with anthrax spores is at risk for contracting anthrax. Most people, however, will never come into contact with the spores. Some groups of people who have a higher risk include animal handlers, veterinarians, people who travel frequently, laboratory professionals working with anthrax spores, military members, mail handlers, and first response workers. What body systems are affected by anthrax? The first body system affected by anthrax is the skin. This occurs through cutaneous anthrax. This is the most common and accounts for 95% of cases. The respiratory tract, such as the lungs, are also affected. This is known as pulmonary anthrax, which occurs when bacterial spores are inhaled. The gastrointestinal system is the last body system that can be affected. This is called intestinal anthrax and is very rare. This occurs more commonly in developing countries. Causative agent and description. Anthrax is caused by a gram-positive, rod-shaped bacterium known as Anthracis bacillus. Anthrax lives in the soil. It grows in aerobic or anaerobic conditions. It requires carbon and nitrogen to grow. Mode of transmission of anthrax. People become infected with anthrax when spores enter the body through a variety of ways. The spores can enter the body through inhalation of spores by the respiratory tract, ingestion of spores through the oral route, such as eating contaminated meat, or when spores enter the skin through a break, such as a cut. This can happen when working in contaminated soil. Mechanism of infection. Soil. Spores enter through inhalation or contact with open skin. Infected animals or animal products can also be another mechanism of infection. Sheep or cows are common animals that carry spores, or eating raw, undercooked meat, raw or undercooked meat from infected animals can also cause infection with anthrax. Signs and symptoms of anthrax infection. Signs and symptoms depend on the type of infection that you have. It can take from 1 day to 2 months to appear. Cutaneous anthrax appears as small blisters or bumps and is often itchy. There's often swelling around the sore. After these blisters and bumps, an ulcer with a black center often appears. This usually is on the face, arms, hands, or neck. Inhalation anthrax appears differently. Often, the person will present with fever, chills, cough, headache, body aches, profuse sweating, chest pain, or shortness of breath. Gastrointestinal anthrax has other symptoms. Gastrointestinal anthrax also appears with fever and chills, as well as swelling of the neck or glands in the neck, a sore throat, hoarseness of speech, nausea, vomiting, and diarrhea, which is often bloody, headache, flushing of the face and red eyes, stomach pain. Patients may also appear fainting, and the stomach often swells, causing a distended abdomen. Anthrax contracted by injection has similar signs and symptoms to cutaneous anthrax. However, it spreads through the body faster and is harder to treat. People who contract anthrax through injection may also have fever, chills, blisters, and bumps that are often itchy, a painless sore on the skin, swelling of that sore, or an abscess which forms where the drug was injected. Diagnosis of anthrax. Diagnosis is typically based on the type of anthrax infection. Inhalation anthrax may be diagnosed with a chest x-ray or CT scans, which will show infiltrates on the x-ray. A blood test is the best way because it measures toxins or antibodies in the blood. Samples may also be taken of the blood, of a skin lesion, spinal fluid, or respiratory secretion. Treatment of anthrax. Anthrax is typically treated by antibiotics given intravenously to the infected patient. Additionally, antitoxin, which targets anthrax toxins in the blood, may also be given intravenously for severe cases. Prevention. People who are at high risk of exposure, such as lab personnel working frequently with anthrax, people who interact with animals frequently, some members of the military may get an anthrax vaccine. The anthrax vaccine consists of a series of 5 shots given over 18 months, and then annual boosters, which are given to continue immunity against anthrax. People who have been exposed but have not developed symptoms of anthrax may receive antibiotics for 60 days post-exposure to prevent anthrax symptoms. Antibiotics given are ciprofloxacin and doxycycline.